Investigation to look at how both extremist political and fringe medical communities are trying to exploit the pandemic online. Carl Miller has been involved in the investigation. He's online now. Hey Carl, how are you doing?
Hi Spencer. That's right, so we've all kind of come across the infodemic in one way or another. We've seen posts that have been forwarded to us, but the interests and ideologies are much less visible underneath it. So we joined forces with a counter-extremism think tank here in the UK called the Institute of Strategic Dialogue, really to try and understand how these social media posts which rubbish science, which spread conspiracy theories, which blame minority groups, how they spread, and something of where they come from and the agenda which they're really pushing.
So this study is ongoing, isn't it? And you're going to look throughout the study at different groups and how they're involved in the misinformation and why. Is that right?
We started with the far right because there's more evidence tying disinformation to the far right than any other group. But they're by no means the only people that do this kind of thing. And in the weeks ahead, we're going to be looking at the far left, at radical Islamists, of course, states, and to see how they too are exploiting this singular moment, spreading disinformation across the internet.
What gathers pace on fringe websites or private chat rooms can quickly enter the mainstream. Stories such as that Bill Gates created the virus got widely circulated, and another blaming Muslims for spreading COVID-19 began in India before moving rapidly across the Atlantic to America.
The internet is awash with this kind of information. We see it in our timeline, sometimes it's shared to us by friends and private groups. We know it's there. But in these early weeks of the pandemic, we wanted to understand who is really propagating this and why.
Fake news spans the entire political spectrum. On any issue and for any argument you can think of, there's plenty of disinformation and hate circulating. But there's one community which more evidence ties the disinformation than any other: the fringe far right. We've seen plenty of examples of false and misleading narratives, but this investigation between BBC Click and the ISD, a global think tank for researching extremism, is one of the first pieces of research that tries to really understand its scale. We homed in on 38 English language public pages on Facebook relevant to the global far right, analysing more than 150,000 of their posts since January.
What started to stand out were 18 key narratives, ones focused around immigration, Islam, gun ownership, crime.
Most striking of all was that as the lockdown progressed, there was a sharp spike in chatter about the world's elites, the likes of Jeff Bezos, the Rothschilds, George Soros, and Bill Gates. Correspondingly, the amount of chatter tying them down to the coronavirus also spiked. Colliver headed the investigation.
We started doing this research because we were interested to look at the intersection between extremism and disinformation online. And we wanted to know how the coronavirus crisis was affecting those trends.
Okay, so the absolute number of posts today are small, and at a time when everyone's talking about coronavirus, wouldn't we expect far-right groups to be doing so as well?
This was just a sample of Facebook groups that we can get access to do this kind of research. So it's very much a kind of top-level example of the trends and the proportions of the far-right's interest and activity around coronavirus. What it doesn't show, though, is what's much more concerning about the scale of this, the mainstreaming of their activity.
Drilling down even further, analysis revealed how each of these themes interacted with each other.
The algorithm sorted the different far-right groups into 5 main communities based on what they spoke about. There were communities clustered around Judaism, Islam, immigration, and LGBT issues. But the largest community by far was interested in global elites and related conspiracy theories.
If you look at conspiracy theories around global elites who are trying to hide vaccines from people, or who created the coronavirus supposedly on purpose, those often have anti-Semitic tropes in about a global elite that is Jewish, and that allows them to promote anti-Semitic content with a cover of talking about coronavirus.
The research discovered that along with tying it to elites, this community was more likely than any other to think the virus was engineered, overhyped, or had an existing cure. Ideas that encourage remedies like chloroquine, unproven and potentially dangerous ideas, despite the suggestions of Donald Trump.
Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information.
We have been here before. Misinformation, we know, is a major issue during elections, but this might be a lot more potent. It really could convince people to not listen to government advice about staying at home. It could convince them to not seek medical help. It might even convince them to use untested treatments with dire consequences.
We put our findings to Facebook, who said, "We have removed a number of links BBC Click shared with us for violating our policies on hate speech and the spread of harmful misinformation. When a post does not violate our policies but is deemed to be false, we reduce its distribution and show warning labels marking it as such, which 95% of the time means people do not go on to view the original content." It seems that claims propagated by fringe groups will continue to thrive and exploit the pandemic.
I think that we'll see an increase in the ability of the far right to successfully mainstream their activity around coronavirus as we see disaffection with the public health measures that are in place across the world at the moment.
That was Chloe Colliver finishing Carl's report. So, Carl, do you know how many people are actually seeing this misinformation and how effective these messages are?
Well, that was the other half of this study, Spencer. So we took 34 websites that the far right often linked to, drawn from fringe medical and political communities largely, and that we know shared materially false information on coronavirus. Now, when you look at the number of interactions they get on a platform like Facebook, all the different comments and shares and posts which links to their websites receive, the numbers are really astonishingly large. Baselining against the World Health Organization that gets around 6 million interactions over the same time period, there were websites on that list that received 48 million, and across all of them, over 80 million. Of course, there are caveats that are important here to remember as well. There's lots of other ways that the World Health Organization gets their message out. And interactions doesn't, of course, necessarily imply agreement whatsoever. But it does suggest that there is an empire of fringe medical and political communities sat on platforms like Facebook that are able to harvest just simply enormous amounts of eyeballs.
Does this study tell you anything about why this infodemic is happening?
I think it really reveals something that's massively important and we don't often discuss about the infodemic. Underneath all of those pieces of information, there is community, there's activism, there's identity, there's belonging and meaning for the people that are involved. These are social architectures complete with heroes and villains and language and gift shops even. This is organisation. And that really sits underneath all of this. And is really propelling the piece of information which, that we see kind of jumping into our timelines.
My goodness, Carl, this is chillingly fascinating. Thank you so much, as ever, for doing these brilliant studies. When you have more findings, will you come back and talk to us?
We will. Thanks very much, Spencer.
Hey there, and welcome to the Week in Tech. It was a week that WhatsApp's limit on forward messaging cut the spread of viral text by 70%. The measures were introduced to help prevent the spread of coronavirus misinformation. Film piracy in the UK increased by 43% since lockdown measures came into effect, although bootleg television is down 5% owing to the lack of live sport. And spoilers for Naughty Dog's highly anticipated The Last of Us Part 2 hit the web this week. After the leak, it was announced the game would be released on the 19th of June, after previously having no confirmed release date. Forget a remote control, now it's possible to conduct robots with your muscles. A team from MIT CSAIL have developed a conduct-a-bot system. It uses human muscle signals from wearable sensors to pilot a robot's movement. If you've ever wondered how an AI's so-called brain might work, a virtual rat may be able to give us a clue. Researchers at DeepMind and Harvard University have built an AI-powered virtual rodent that can carry out multiple complex tasks. It's hoped that the rat will help the teams understand how its artificial brain works. And finally, forget Zoom weddings during the time of quarantine. How about a ceremony via Animal Crossing? Stefan and Jana had to postpone their real-life April wedding until November, but didn't want to miss out completely, so they had a virtual one on Nintendo's hit game instead. I wonder how many bells that would have cost them.
The use of drones for delivery is often hyped, but with strict regulations has never quite got off the ground. Will the current need for contactless deliveries jumpstart the sector? The village of Moneygall is 140 kilometres southwest of Dublin and the site of a proof of concept partnership between drone company Mana Aero and the country's health service executive. Mana Aero are already testing essential food deliveries from this service station. But now, with the coronavirus lockdown, they have shifted their attention to medicine.
Hello, Dr. O'Reilly.
The new service starts with a GP video consultation.
A cough bottle for that.
The doctor sends a prescription by email to a nearby pharmacy.
And they're going to deliver the drugs back to you by drone delivery.
Okay, no problem.
The medicine is attached to a drone and is transported to the patient's door. In this case, people who are currently self-isolating.
I'm 70 years of age and we're told to stay in, so we've stayed in, we've never gone out anywhere. Oh sure, it's absolutely brilliant. I thought I'd never see the day that there'd be such technology that I wouldn't have to be driving into town and back home to get my medicine.
The UK too is considering how drones can be used to transport vital medical supplies.
We'd like to be there in the next few weeks. We would like to start something in the UK in a similar setup to what we're doing here in Ireland. It's to support the local communities during these times. And we're in discussions. Our plant and our office, our R&D is in Wales, so we'd like to do something initially in Wales to show the UK public what it looks like.
Wales has already been the site of remote drone delivery testing. Just before the lockdown, a drone successfully dropped a defibrillator over Snowdonia in Wales. It was a successful beyond line of sight test in collaboration